Throughout the BRInC program, we have researched and analyzed the function and construction of a lower limb prosthetic. After brainstorming many different ideas with our mentor, we decided to design our own prosthetic limb. We designed several different prosthetics which were built with the help of our teachers.
We started off our design process by measuring our right foot and our height from below the knee of the right leg. These measurements were then used to build our prosthetic. Each participant built their own prosthetic so that it would best suit our body's dimensions and we could perform a range of biomechanical tests. Originally we had an 8-year-old boy with a below-the-knee amputation, but we soon realized that no one could do the testing for him, so we changed the persona to our age and sex. In order to make the prosthetic more pleasing for a teenage girl, we decided to spray paint it and included small patterns such as butterflies over the top. At first we used a plunger to support the weight of our legs, but this soon became quite uncomfortable due to the disruption of blood flow and a lack of assistance. Later we discovered that a more suitable method of wearing the prosthetic would be to use plaster cast to create an accurate mold of our knees when bent.
When we conducted our testing, we did several trials. This meant we could use our gait anywhere, not just in the biomechanics lab that requires using motion cameras to capture our walking motion or gait with and without the prosthetic. This gait analysis is a computer program which needed us to use 2 iPads and a laptop and a sheet of black and white squares, allowing the program to configure depth rather than needing to use a large number of cameras and reflective dots, saving time and resources. We had to add a few attachments to ensure that the prosthetic would stay on our legs while we performed this analysis. We compared our normal walk and our walk wearing the prosthetic to see the differences. This was much clearer using the gait analysis software as it showed movement in the form of a skeleton. Our posture changed clearly as we were thinking too much about walking normally. The prosthetic limb was a big change, leaving us with no sensation in our leg or foot touching the floor. This made us very cautious of where the prosthetic leg was going, and we had to swing our hips to get momentum. This meant that we adapted our walk using our eyes to make sure the prosthetic landed properly on the ground without having to completely rely on the crutches. However, relying on the prosthetic leg left us with poor balance and a high risk of getting hurt. The crutches helped us to apply less pressure on the leg, but our legs were still uncomfortable, making walking much more difficult.
One of the improvements we discovered was the lack of feeling and movement of the knee and ankle. The plaster cast on our knee restricted the movement of our joints, and as a consequence, our ability to control where the prosthetic moved. This made it difficult to know where the prosthetic was being placed on the floor, as there was no sensation. The ankle was also a problem because without the rotation of the foot, we found it very difficult to walk. Future designs would include an ankle-like structure. Since we aren't amputees, we had to improvise and fold our leg, which was quite an experience. It was beginning to become uncomfortable after a while. Though the cast was moulded onto our knees, it was awkward trying to keep the prosthetic from moving awkwardly on our knees. Therefore, we added a few things like compression fabric and sports strapping tape to help us keep the prosthetic on, but it was scary as we didn't feel confident that the leg would support our weight. We were prone to falling with the leg on. In future, we would definitely make the leg more stable and comfortable. Overall, this challenge was really complex as a human leg has bones, muscles, nerves and tendons that all work together to coordinate the movement. This is something that cannot be replicated in a prosthetic, explaining why we had so much trouble trusting the prosthetic prototypes.
The opportunity to work with Sam and Crystal to help us research, design, build, and test our prosthetic legs was invaluable. We originally wanted to design an adjustable leg for a younger child, but soon found how challenging this would be. We now appreciate the complexity of designing a prosthetic that allows children to be able to do all the everyday activities that we take for granted.